Where are you capturing these details? Is that in your history versus is that in your evaluation? Because that's what I feel we're missing out. Yeah. So please share how you are approaching your patients in your office.
Absolutely. So again, if you are coming in and you've never seen a gastroenterologist, and I'm seeing you for the first time and you're my first referral, not you've seen me, you're coming to see me as a second referral, then you may get an endoscopy or colonoscopy depending on how sudden your symptoms are, if there's any bleeding, if there's anemia, things like that. You may also end up getting certain blood tests, such as looking for celiac disease, looking for the anti-trans glutaminase antibody. You will likely get tested for H. pylori, whether it's during the endoscopy to make sure there's no ulcer. I'll also be looking for anatomical things. Oftentimes, people have something called a hiatal hernia as to why they actually have a lot of reflux, or they may have diverticuli and having repeated bouts of diverticulitis as to why they're having abdominal pain. So if you haven't gotten a scope, you may actually end up getting that with me. But let's say you already have at all of these stuff is negative. Your CT is negative, your ultrasound is negative, your blood work is normal, and you come in, the first thing I want to do is get a good history, right? I want to understand what exactly has happened to you and, in your past, right? What was your childhood like? What has been your past history? Have you had a lot of, you know, abuse? Have you had a lot of anxiety? Have you had family history or personal history of depression? Were you in the military? Were you a victim of child abuse, sexual abuse, domestic violence, right? Are you in a very stressful job or are you a super type A personality?